Welcome to episode 1 of the Psych Health and Safety podcast. My name's Jason Van Schie and I'll be your host for today. I'm super excited to finally record this thing that we've been planning for months to get much needed information out into the world. The goal of this podcast is to rapidly advance the practice of psychological health and safety in companies worldwide. Each episode will feature a conversation with professionals who know their stuff and are leading the way in relation to psychological injury prevention and mental health promotion. We'll be speaking to health and safety practitioners, academics and psychologists from all over the way. For those interested, we'll be videoing each episode, so you'll be able to view it later on YouTube if you like. We'll also be cutting highlights and sharing these through the FlourishDX LinkedIn page if you want to follow that. The format for the show will be pretty simple. We'll have a chance to meet our guests and find out a bit more about them personally and professionally. Then we'll sink our teeth into a core topic related to psych health and safety. As today is episode 1, and we'll have many people new to this area, we're going to start with the basics. The topic today is, what is a psychologically healthy and safe workplace? Now, ordinarily at this point in time, we would introduce our guest, but maybe because it's episode 1, I should introduce myself to you first. So I'm a psychologist and I've been working in the field of psychology and risk management for about 10 years now after studying a master's in occupational psychology. I was really interested in around about 2007, 2008 with fatigue risk management and fitness for duty. And I worked in a role as a contractor to a large psychology consulting business. And the focus really was on going around Australia, talking to companies and resources and mining, particularly around how can we keep people safe from unseen things, whether they be alcohol and drugs, whether they be fatigue, whether they be mental health. In 2013, I founded People Diagnostics with more of an emphasis on health promotion. So I was interested in looking at things like sleep health, but more from a health promotion perspective, as opposed to purely risk management. In 2014, I was introduced to the field of positive psychology. We had a local school who had been to Geelong Grammar and had learnt all about positive psychology and how to implement it for student wellbeing, and had a need to measure whether what they were doing was actually effective. And knowing about some of the things that we'd done in that space around measurement and mental health and wellbeing, they approached us to develop a tool which we now have known as Flourishing at School. About the same point in time, we were working on things like fatigue risk management training and mental health training for a large multinational mining client. We also then started to look at, well, if we're going to do this, how are we going to do it at scale? How are we going to keep people well? How are we going to optimize well-being? And I was really encouraged, and shout out here to Ollie Bridge, who has previously worked at Medibank, who really encouraged me strongly to think about scale. And, this is the issues that we're talking about, whether it's mental health, whether it's fatigue and sleep. They're not just Australian issues, they're not just Perth issues, they're global issues. And so he really encouraged me to think about, how are you going to do this at scale, Jason? And that's when, I guess in 2017-18, we actually made the leap into becoming a technology business. And from that point, I guess we really started working hard on a product we call FlourishDX, and its goal is to keep people well and optimize mental well-being, using more of a health and safety approach to psychological injury prevention, if you like. And I guess, what I'm doing now as part of the podcast is to really try and disseminate the knowledge around psychological health and safety. What I've definitely noticed from consulting to businesses over the last 10, 15 years is there's a real focus on the individual when it comes to mental health. How can they keep themselves well and manage their stress and resilience? How do they be more mindful? But what there's been a dearth of information on is, how do we as an organisation create a healthy and safe working environment so people go to work and they don't get sick? They don't become stressed and ill and need to take time off work or make workers' compensation claims. So I'm really interested in marrying the two together. Like, how can we do health and safety well in terms of risk management in relation to people's mental health and wellbeing? But then how do we take someone from 0 to positive 10 and really optimise their level of wellbeing as well? Now, today we do, and I did mention this early on, that we do have a very, very special guest today. This person I've been wanting to work with for a while, and I'm pleased to announce as of the 1st of February, she is now an employee of People Diagnostics, and we're going to be working very closely together. So Normally we would have another guest on, but this time I'm going to introduce my co-host, and we'll be doing this episode together. So what I'd like to do is to introduce you to Joelle Mitchell.
Hello.
Glad to have you here.
No pressure.
No pressure at all. No, I'm really, like I said, I'm really stoked to have Joelle on. We're going to get her to introduce herself in a second. She is an organisational psychologist, has a really good experience in the human factors area, and we will be co-hosting this podcast moving forward.
Thank you. I'm excited to be here. This is my first time doing a podcast, so we'll see how it goes, I guess, won't we?
Yeah, we will. So maybe, Joelle, maybe you can tell us a little bit about yourself personally first. So what do you have a family?
Yes, so I'm married and I've got a 7-year-old son who over the Christmas holidays just got his first 2 wobbly teeth, which is a very exciting moment for a child. So, yeah, that's my personal life, I guess.
Yeah, okay, yeah, beautiful. No, I've got a 5-year-old who just lost their first tooth. So clearly your kids are eating healthier than mine. Mine are losing their teeth too early, 2 years earlier than yours.
He was a bit worried why it hadn't happened yet, so
yep.
He's feeling relieved now.
Yeah, great. And professionally, tell us a bit about, I guess, where you started and how you made your way to people diagnostics.
Yep, so that's a little bit of a twisting tale. So I started with an undergraduate degree in psychology. I did honours and then wasn't really sure where I wanted to go with it. I knew that clinical psychology wasn't really the path for me. My thesis was in the area of community psychology. I was looking at the importance of country to the Aboriginal worldview. Graduated, not a lot of work for people with an interest in community psychology, shockingly, with an undergraduate degree. So I ended up just getting a job doing document control with a company that was an EPCM for a petroleum production company. So I was there for 5 years, not doing document control for the 5 years. I sort of worked in a few different roles within the company and ended up in their safety team as a behavioural safety advisor. And when I joined the safety team, I also started the Masters of Organisational Psychology. So I was doing that part-time while I was working there. Then there was a global financial crisis and I had a redundancy experience.
Yep.
Which gave me an opportunity to do my second placement with my degree, which was actually at an outplacement provider, somewhat ironically. And then I moved on to a consulting group from there. So I was doing consulting in sort of the safety psychology area, mostly onshore mining and construction in the Pilbara. So I'd travel up there probably once a fortnight and spend a few days in the dirt out in the field doing some supervision coaching, and we would do training, safety leadership training with the frontline leaders out there. We also got into some safety culture assessment and some sort of bullying policy development and a range of other things in that type of area. But it was, a lot of really sort of frontline safety communication and effective safety leadership training was really the focus of what we were doing there.
Yep.
Then in 2012, I joined NOPSEMA as a human factors specialist, which was a new role for NOPSEMA. The acronym,
this is going to test
it's a long one, the National Offshore Petroleum Safety and Environmental Management Authority, which is a long way of saying the regulator for the offshore petroleum industry in Australia. And I've been there for 9 years. So it was a good innings there.
Yep.
But now I've come across to people diagnostics and I'm very excited to be here.
Yeah, great. So when you're at NOPSEMA in your human factors role, to what degree did you work in the psych health and safety kind of area?
I think it's an emerging issue now for industry, and I think it's something that I'd sort of been nudging at in within the agency, and something that we've been aware of. We've sort of had bullying issues that we had dealt with in the past, but I think that the COVID pandemic has really brought the issue of workplace mental health to a head, and so it was something that the agency started to prioritise. So certainly in the last 12 months, I've done quite a bit of work in that area. We've done a few inspections of operators in relation to their psychosocial risk management tools and systems that they have in place. We've done some more in-depth investigations into bullying and sort of the associated systems around preventing and responding to that. And as of leaving, there's a draft guidance note on psychosocial risk management in the pipelines that will be coming out for public comment at some point.
There you go. Great. Yeah, no, I was very thrilled when you said that you'd come and work with us. So why did you? I haven't actually asked you this question. So why did you choose to get out of the regulator and come join a mental health startup?
I think that, so people talk about like having a 5-year plan, and I don't really do that. I suppose I think about what kind of work I want to be doing and what kind of impact I want to be having. And I think looking at the business model that you have in place here and the product that you've developed and the way that product can be accessed, the opportunity for reach and impact I think is really, really significant. And the opportunity to be able to contribute to that and to be able to be working with a tool that's really strongly based in the evidence and the science underpinning it. I think about, the potential to impact the lives of so many people in so many organisations in a positive way. And I've seen what happens when organisations don't manage mental health risk well, and the impact that can have not just on the individual themselves, but their immediate family, their work group, and sort of the longer lasting effects that can have, over a period of years beyond the initial illness and recovery process. So I guess having seen that firsthand, it's really highlighted to me the challenges that businesses still have in really grappling with this concept of how to appropriately manage psychosocial risk in their workplaces. And I'm really looking forward to the opportunity to help them understand what that looks like and take a comprehensive risk management approach to the way that they look at it.
Yeah, absolutely. I love that idea of the reach that we can have, right? Using technology as kind of the backing instrument to allow us to reach scale. I remember, delivering training programs to 20 or 30 people at a time. And I was thrilled when people would come up and say, that was awesome. Or come up a few days later if I'm on a mine site and say, hey, look, I tried that thing that you suggested regarding my sleep and I haven't slept better ever. And it'd just be so great, right? But what we're hoping now to do is to impact on the lives of tens, hundreds, millions of people. And really it's working again in that preventative space. We know how much of a toll it can take on people when they have poor mental health. And it's not just the individual, but their families, the communities, the workplace. So if we can keep people well to start with, I think that's going to be amazing. Yeah.
Absolutely.
Great. Well, I'm sure as we go through the podcast episodes, a little bit more of our backgrounds and worldviews are going to come out. And so I probably should leave it there and probably start talking about the topic for today.
That's probably a good idea.
Which is what is psychological health and safety. So for a podcast that's all about it, we should probably define it to start with. But where I thought would be useful to start with was defining the term mental health first. Okay, because many a times in workshops, I've asked groups the question, when you hear the term mental health, what's the first thing that comes to mind? And you can imagine, right, that most people will automatically think depression, stress, anxiety. Some groups have even said things like psychosis or schizophrenia, which is interesting because they're actually very serious forms of mental illness. And it's particularly interesting, I find, because if I use the term physical health, they don't automatically think about diabetes and cardiovascular disease. So I think there's these connotations with mental health, or at least, many people treat mental health as a synonym for mental illness. which then if we extend that to the definition of a mentally healthy workplace, then most people, if they're thinking about mental health being about illness, it's about then, well, stigma reduction. Like, how do we get people comfortable talking about it if they've got a mental illness? How do we get people having peer-to-peer conversations if they're concerned that someone's not right? And I find those things, whilst useful, are very much in the reactive end, right? What we want to do is to be more preventative. Like, how do we actually prevent someone from getting ill in the first place? Yeah. And that's why I guess I've been drawn more to this field of psychological health and safety and definitions around that term. And you'll probably hear us use that term, a psychologically healthy and safe workplace, more so than a mentally healthy workplace, because of the reasons I just explained. But I really like the definition from the Canadian standard about a psychologically healthy and safe workplace. It's one that promotes workers' psychological well-being and actively works to prevent harm to worker psychological health, including in negligent, reckless, or intentional ways. So basically, what it's saying is we need to have things that promote the positive, like how do we improve worker well-being, but also how do we prevent harm, which then brings into play things like risk management, identifying and mitigating hazards. Now, if you want the formal definition of mental health from the World Health Organization, it's a state of well-being in which every individual realizes his or her own potential, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. So not a single bit in there about illness. It's more focused on the well-being, and the national standard of Canada does focus on more the positive aspects as well, and harm prevention and well-being promotion.
Yep.
And what again, the other thing I really like about this is if you think about mentally healthy workplaces, one that's purely there to accept people who have a mental illness and reduce stigma, it doesn't actually make a high bar for employers to cross. If all you have to do is accept people with a mental illness, I think most organisations can do that. But if you actually need to have a documented process on how you're going to identify and mitigate hazards, and then monitor those over time, and then use a continuous improvement approach. Obviously, this actually requires a fair bit more of employers. And maybe to date, maybe that's why we haven't seen so much of employers actually doing that of their own volition.
Yeah, I think certainly what I've seen is a lot of emphasis on, we'll have an EAP in place and we'll provide resilience training, or we'll have some mental health first aid training, and, that's all good stuff. But if you think about it, what it really does is put all of the onus on each individual worker to take responsibility for managing that risk themselves, and you're not actually reducing people's exposure to those hazards that are present in the workplace that are contributing to that stress and strain and psychological discomfort, I suppose. So, if you think about it from a physical safety perspective, essentially that's like providing people with earplugs and not looking to reduce the source of the noise that's causing the hazard in the first place. So we really need to take a step back, look at the entire system and look at what are those hazards that are present in the workplace that are presenting a risk to people's psychological health, and what can we do as an employer to try to reduce the impact of those hazards on the individuals.
Yeah, absolutely. And I think that's one of the common, complaints or criticisms of the current approach to workplace mental health is that it is very much focused on the individual. Be more resilient, be more mindful. It's not the employer going, well, actually, it's the way we've designed the workplace that is causing you to become ill. Again, if we use a physical health analogy, it's kind of telling people if they've got to do a lot of manual handling in their role, go to the gym and get stronger. Let's not give you lifting aids, or think about how we handle things physically.
Yeah, we won't reduce the size of the boxes we're giving you to shift around. We'll just tell you to build your muscles up instead.
Yeah, that's right. So I think when we talk about it like that, I think people could see, particularly health and safety professionals in the audience, how they can see how backwards the current approach to mental health is.
Absolutely, yeah.
Yeah. So do you have anything else to say on that around, making it clear what we're talking about on this? I did mention in the trailer, we're really not talking about fruit bowls and yoga here. That's very much focused on the individual, not on, the workplace systems, I guess, that contribute to psychological health and wellbeing.
Yeah, so for me, I think this is very much about us helping employers and other responsible parties to really understand psychological health and safety within a risk management context.
Yep. Yeah, absolutely. Yep. And I remember actually just recently on LinkedIn, we had a bit of a discussion around this idea of psychological safety versus psychological health and safety. And you said, well, why not call psychological health and safety just psychological risk management to avoid the confusion? And that's really, I guess, the main lens that we'll be looking at this through, looking at risk management.
Yeah, I think the benefit of talking about health and safety rather than just risk management is that it does also provide that opportunity to talk about the positive side of psychology and move into that sort of flourishing at work elements, which you don't really look at when you're talking about risk management, because that's really just preventing the damage and it's not about improving the outcomes on the other side. That's
right. And again, that's why I like the standard the standard of Canada's definition so much as well, because it's not just about the prevention of harm, it's also about the promotion of wellbeing.
Yeah, absolutely.
Yeah, great. So let's then think about how that might fit in what we're talking about with the integrated model of workplace mental health. So this idea of the integrated model, I guess that term became popular because of Professor Tony, now I've got to say his name right, Lee Montagna, I believe it is, from Deakin University. I've seen him present now at a couple of conferences in the last couple of years about this model. It's very similar to the public health model, if you like, in that you've got 3 levels of intervention that you can make. But if we think about mental health being a continuum, right, ranging from illness to wellness to flourishing, basically in a large enough organisation, we need to have a range of different interventions or activities that we're doing to meet people where they're at in relation to their mental health or ill health. And so if we think about primary prevention, Tony would refer to that as promoting thriving or flourishing. Then we've got secondary prevention, which would be about prevention of harm. And then we've got tertiary prevention, which would be about mitigating illness. Now, I think we've both seen, Joelle, that the majority of organisations, and again, this might be because they're looking at mental health through the worldview that it's about illness rather than wellbeing, that the focus is on the reactive. So most interventions in workplaces seem to be tertiary or around mitigating illness. So EAPs, mental health first aid, return to work programs, that sort of thing.
Yeah, absolutely. It's all about how they're responding once somebody's already experiencing that psychological distress, and there's very little in there around preventing that distress in the first place. Yeah.
And look, to the audience, we're not against these approaches. I think they're very much needed.
Absolutely. They're a really important part of it, but important but not sufficient.
Yeah, that's right. So those are things that are all, really good employer of choice kind of considerations. Interestingly, and you can back me up here, Joelle, none of these are actually a compliance activity. There is nothing in the Workplace Health and Safety Act that says you need to have an EAP in place.
No, that's correct.
Yeah. So it's funny that employers are doing that, not doing the risk management stuff, which is actually tied to legislation.
Yeah.
Okay. All right. But the other thing that we are starting to see a bit of as well is so we talked about mitigate illness and kind of the main activities underneath that banner. Promoting flourishing, we are starting to see more organisations do. So these things might be work design. And Professor Sharon Parker is someone who's really big in this area from the Future of Work Institute at Curtin University, and maybe we'll have her on at some stage to talk about her model of smart work design. But the idea behind that is if you can design work from the outset that we know is actually going to be good for people's mental health, then you're going to have higher levels of productivity, engagement, and less psychological injuries. Yeah. So it's like designing or engineering, I guess, your physical work environments, understanding that, there are common hazards, so let's control them from the outset. It could also be, I know you've got a bit of experience in the fatigue space as well, and I really like the comparisons we can make between fatigue risk management and psychological health and safety or psychological risk management, in that both are unseen, right? We still can't measure fatigue very well, Okay, so fatigue measurement's an issue. And it's hard to, I guess, get an objective measurement of how mentally healthy or ill someone is as well. We rely a lot on self-report for both.
Yeah, very much so.
And really, when it comes to fatigue risk management, we focus on things like biomathematical models of sleep, wake, and that sort of thing to try and determine what is safe for the majority of people, right? Yeah. And so work design is very much going, well, we know things like having autonomy in someone's role, having a sense of mastery, using your strengths, having positive relationships in the work environment. They're all good for mental health. So let's design jobs that have those things in them to begin with.
Yeah, absolutely. Autonomy, the right level of challenge, not too much. There's the Goldilocks zone of workload and all of those types of things we know are beneficial. So they're actually protective of mental health.
Yeah. So, we don't have to wait for people to start getting ill at work, right? Before we start intervening, we can design work, and this is at a systems level, to keep people healthy. The other thing we can do, I think, at the flourishing level or promoting flourishing level is to think about how do we optimize people's wellbeing. Now, what I like to talk about here is in the physical realm, we focus on the SNAP acronym. So smoking cessation, nutrition, alcohol in moderation, and physical activity, okay? If we add sleep in there as well, right? If we do all 5 of those, we're less susceptible to illness. And if we do them really well, we'll reach a high level of physical well-being, okay? But when we talk about health promotion in workplaces and mental health promotion, a lot of them then go, oh yeah, we're doing exercise, we're doing diet, we've got end-of-trip facilities, we've got healthy vending machines, we have running clubs, step challenges, that sort of thing. So they're very much focused on the SNAP stuff for mental health. Now, we're talking before the podcast, Joelle, that we know from the research that there is a link between what we eat or how much activity we do and the type of activity and our mental health. But I find it interesting that people or organisations don't think, well, if we want to have a positive impact on mental health, why not use a positive mental health intervention rather than relying on the physical ones? Right?
And I think that that's a lot to do with marketing, probably, that a lot of those physically healthy programs have been very well marketed to businesses, so they know that they're there, and I suppose that's part of what we're doing now as well, is letting businesses know how they can actually approach this positive psychological health in the workplace. So that's I guess addressing some of that gap in the information that's out there.
Yeah, absolutely. So I guess one of the models that companies can look at, rather than using the SNAPS acronym for mental health interventions or positive mental health interventions, is to think about the Perma Model. So the Perma Model is from the field of positive psychology. It was made, or I guess it was kind of coined by the psychologist Martin Seligman, who was the president of the American Psychological Association from 1998. And when he came in to that role, he had said, well, look, the focus of psychology traditionally has always been on illness. So how do we identify it? How do we treat people? How do we bring people back to normal? There wasn't as much of a focus, or a very small percentage if you think about all of the literature in the field of psychology at that point, that was focused on how do we take someone who's actually well already or doesn't have depression and bring them to a level where they're flourishing, so having an optimal level of well-being. And so the model PERMA is an acronym that stands for the 5 pillars of good mental health. So that includes having positive emotions regularly, like joy, awe, love, gratitude, hope, all those nice things. Having a level of engagement in what you do is the E. And when we talk about engagement, we're not talking about the annual employee engagement survey that you might do in your company, but we're talking about the concept of flow. So how absorbed are people in their activities to the point that time passes really quickly and they, become really just immersed in what they're doing. Hopefully you experience flow every now and again.
I do, yes.
Yeah.
Yes, depends how many people want to interrupt me.
Yeah, that's right. So avoiding interruptions, leveraging your strengths, doing something that you're good at, getting that right level of challenge for your skill level, those sorts of things are all important for people who want to get more flow. For the R in PERMA, we're talking about positive relationships, particularly those that are focused on trust and mutual respect and enjoyment. Having a sense of meaning or purpose is the M. I would argue from what I've read and some of our own research that we've done internally, that having a sense of meaning or purpose is actually the most important thing if you want to experience a level of flourishing.
Yeah, absolutely. I think everybody wants to feel like what they're doing is important and useful and meaningful. Pretty sad if you don't have that sense that what you're doing is contributing to something, or that it's, important to somebody else.
Yeah, and I think that's where people like Simon Sinek are becoming really popular, right? Because he's got the book Start With Why, and that's all about purpose, and start with talking about why we're doing something rather than how or what we're doing. It's why, and aligning people to a shared vision or goal is so powerful for human motivation.
Yeah, and you get that intrinsic motivation as well that comes along with that when you feel like you're doing something that has meaning and that's aligned with your own values and what you feel is important. Then there's a lot of intrinsic reward that comes with the work that you're doing. So that's an added bonus, I suppose, on top of the compensation and other elements that you get from your job. If you've got that internal reward that happens every day that you're doing the work that you're doing, then that's a positive reinforcement loop.
Yeah, absolutely. Yeah. And then the A in PERMA is for accomplishment. So feeling satisfied that we're doing, again, meaningful things day to day, ticking things off our to-do list and having larger accomplishments in life as well.
The sense that you're competent at what you do is really important to that sense of self.
Yeah, absolutely. So the better we do in these 5 areas, like our SNAPS areas, the less susceptible we are to mental illness and the more likely we are to reach a high level of flourishing or well-being. So I'm really interested in that area of flourishing and using the Perma Model. And we might even have some people from the positive psychology realm at some point. But really, this is a health and safety podcast first. So we will be having guests on initially that are really more focused on the systemic approaches to employee mental health that focus on work design, risk management versus the health promotion stuff.
Yeah.
Yeah. So let's then think about the other part of the integrated model. So we talked about promoting flourishing, we talked about mitigate illness. This is the area I think that many organisations aren't doing so well, and that's the prevention of harm. Okay.
Yes.
Yeah. And so really if we think about physical risk management, right, so we know what our main hazards are in a workplace that we have to identify. So there's 4 steps to the process, right? You identify your hazards, you assess the level of risk, you put in controls and you monitor over time, and it's a loop, so you continuously improve.
Yes, the basic risk management cycle. Yep.
Yeah, that's right. And let's not forget we have to consult with staff
Absolutely.
throughout the process as well. Yeah. So if we think about identifying hazards, we know the common hazards within most workplaces, electrical hazards, manual handling, working at height.
Explosions.
Yeah, it depends what industry you're in. Confined spaces, chemical exposures, dust, that sort of thing, right? So we know what the main hazards are, and they're fairly easy to identify, most of the physical hazards, because we can observe them directly.
Yeah, we know what they are. We know how they occur. We know what we need to do to prevent them from causing damage.
Yeah. So so we can generally identify those hazards by just observing the work environment, looking around. Okay. The next thing we need to do is to assess the level of risk. So the likelihood and consequence that if someone is exposed to this hazard, that they're going to have an injury or something not great happen to them. Yeah. So within a workplace, if we're going to assess the risk, generally there's some good research or case studies around the place that help us understand if people are exposed to silica dust, this is kind of the exposure that leads to ill health.
Yes.
Yeah.
Varying levels of evidence for different outcomes, I suppose. And yeah, I think the risk assessment process is probably a little bit more qualitative than people probably like to admit.
Yeah.
A little bit more, finger in the air,
yeah,
feeling the wind kind of thing. But it's still an important step.
Yeah, I remember an interesting discussion where we were facilitating an organisation as they were reviewing their fatigue risks and strategies that they had in place. And this one company had about a half hour, 45-minute drive from where most people were located in town out to their facility. And they were running, 12-hour rosters, which are common. So, workings from 6 a.m. till 6 p.m. and they'd do that for 7 days straight kind of thing, which is very common up in the Pilbara in particular in Western Australia. But they were all driving themselves, right, these people, and they had 3 cases in, I think, about 6 months where people had fallen asleep at the wheel, driven off to off the side of the road. And if there'd been a tree there or something, they probably would have killed themselves, right? But luckily there was no fatalities, but they were very high incident potential near misses. Yeah. But when we were doing the risk assessment, going, okay, what is the risk? They were very much saying, oh, it's not a catastrophic risk. We haven't any fatalities. Now, they had 3 high potential near misses, and they didn't want to pull, like you're saying, it's more qualitative rather than quantitative. They're like, oh, how can we get it down so it's, maybe more of a moderate risk or a 3 on our category of 5 rather than, because then we don't have to do anything about it.
Well, that's right. So there is all of that, all of that statistical manipulation that that can go on in the back end when you're talking about risk assessments. So, yeah, I tend to take any of those types of assessments with a bit of a grain of salt when I'm looking at them. Yeah.
Yeah. So I guess we know, and companies are getting very good at understanding and controlling the physical risks, right? If we talk about the injury frequency rates and that sort of thing, they've been coming down historically as the safety profession gets better and better at understanding roles and understanding and managing risks.
Yes.
But if we talk about the psychological risks, we're not doing as well. So what we're seeing is, and we'll talk to some statistics in a moment that show this, but we're seeing that we're actually getting more psychological injuries occurring year on year across the world, not less.
Yeah, absolutely. And whether that's partly due to people feeling more comfortable coming forward, but also just, I think, workplaces are becoming more stressful. Economic drivers are becoming more significant. Job insecurity is increasing. You've got this increasingly sort of casual and gig-based economy. So all of those things are compounding, and then you've got the pandemic sitting on top of all of that. That's just.
I was hoping not to talk too much about COVID today.
No, but it's
it's 2021.
If only it was that simple, just flicking a switch, it's a new year. No more pandemic.
Yeah, we're very fortunate, I should say. We're recording out of Perth, Western Australia, and we haven't had any community transmission for more than 9 months, so we are kind of blessed. Absolutely.
We're living a relatively normal existence compared to the rest of the world, so...
Yeah, one of the benefits in being in one of the most isolated capital cities in the world. So
absolutely. Should we do a knock on wood while we're saying that?
Do that for sure. But so let's think then about the common psychosocial hazards. So a psychosocial hazard is anything in the design or management of work that causes work-related stress. Now, we know that not all stress is bad, right? So we need some stress to motivate us. I mean, if we didn't have any stress in our life, if it was really cold and raining outside, why would you get out of bed? So
I wouldn't.
I've got 3 kids. If they were still asleep, I'd still be in bed too.
Absolutely.
Yeah. So we need some stress, but I guess when stress is continuous without a respite, or if we're talking about very high levels of traumatic stress, like being exposed to bullying and harassment or occupational violence, then people are more likely to have a negative stress reaction and maybe suffer a psychological injury and require time off work.
Yes. Yep. Absolutely.
Yeah. So what are some of the key psychosocial hazards?
So you can talk about the job demands resources model, which is essentially that different people have different capacity for workload and for job demands. So this is really what your employer is asking you to do and what the requirements are for you to be able to do your job successfully and do what you need to do to keep your job and to do it well. So we've only got a finite capacity for taking on job demands, and a lot of that has to do with the resources that are available to us to be able to meet those demands. So their resources can be personal factors like, intelligence, personality, tolerance for stress and that type of thing. But then we've also got resources that can be provided by the organisation, and that's, to do with the volume of people who are around to do the workload. It's got to do with the quality of leadership and the interpersonal relationships that you have. It's got to do with things like the, broad company policy, around economic factors and, you know, what is it that actually drives us at this company and what's most important to us. So when we get an imbalance between the job demands and the job resources, then that's when we start to experience psychological distress.
Yeah. And I guess depending where in the world you are, there's more of a focus on some psychosocial hazards than others, right?
Yeah. And what type of work you do as well, I suppose. So psychosocial hazards for a first responder will be very different to psychosocial hazards for an engineer. Yeah,
or a school teacher.
Yeah,
absolutely. I mean, if we think to the UK, they have their stress management standard, right? And they've got 6 hazards that they refer to, things like control and workload and clarity and that sort of thing. In Canada, they've got 13, including things like civility and respect, which probably requires its own episode.
Yeah, absolutely.
The show. Growth and development, things like that. And then in Australia, I think there's about 8 that we generally refer to, including things like job demands and autonomy or control and relationships and organisational justice even, so perceived fairness in how decisions are made.
Absolutely, yeah.
Yeah. So when we talk about psychological health and safety and risk management, it's not about trying to identify if people are ill. Okay, that's very much an individual focus. What we're trying to look at is controllable workplace conditions that are usually tied to the design of work that can make people ill if not done correctly.
Yeah. So what can we do as an organisation, as an employer, to put people in that Goldilocks zone for job demands where they're challenged enough but not to the point of being overwhelmed, and creating a work environment that people feel comfortable and happy in, and where they're able to form those meaningful relationships and do the work that they feel is important to them.
Yeah. So I guess the next step after you've identified those hazards, and sometimes we just know like these are the things that we should focus on. Sometimes we should be consulting with staff as well and asking their perspective. Obviously, they know their job better than most, particularly senior management. The person that's on the floor will actually know what they're doing more so. And so there's many ways you can do that, right? So talking with people, focus groups, surveys, however you do it, it's just about how do we identify these. And then the next step would be assessing the level of risk. And kind of like with fatigue, it's not a one-size-fits-all, right? The level of risk. Like we can all be exposed to different levels of stress and all have different varying effects on us, right?
Yeah, absolutely. We've all got different tolerances. And I suppose the other thing is that, we've all got different things going on outside of work that also impact our level of tolerance for what goes on at work. So, if our brain is a cup, once it's full, that's when we get overloaded and we start to experience that distress. So factors outside of work contribute to the cup just as much as factors inside of work, and we can only compartmentalise so much.
Yeah. It's interesting, right? Like that sometimes comes up when I'm talking with organisations, and they'll say, well, look, mental health, that's the individual's problem. If they're doing something stressful outside of work because they've got relationship issues or, a child with problems or something like that, they're bringing that to work. That's not our responsibility. But then I would counter that with, well, what happens if someone had, frail bones or, existing muscle issue, right? Would you just go, oh, that's your problem, so we're not going to actually try and help you out at work by designing work that isn't going to exacerbate the issue that you've already got?
Yeah, absolutely. And if I think about my own experiences, when I've had things happen outside of work and, fairly significant traumatic issues outside of work, the response that my employer has had has been, well, take whatever time off you need, come back when you're ready. And even once I'm back at work, the workload has been adjusted for me to be able to do what I can, and recognising that, when I've got the capacity, I'm going to build back up and probably be more committed and more loyal to that organisation because they've been there and they've been supportive and responsive to what was going on outside of work. So it really does make a big difference. I think, if I'd been working somewhere that didn't respond the way that they did, then I would have absolutely developed depression, no doubt about that. Burnout, I probably would have become unemployed, all sorts of things. So it really does make a huge difference.
Yeah. So really, a lot of it comes down to treating other people as we want to be treated ourselves, right? As another human, right? Rather than a piece of machinery. And yeah, hopefully more employers start to take that perspective moving forward, understanding. And that's, again, one of the goals of the podcast, right? To kind of disseminate this information and change people's mindsets around some of these things.
Absolutely, yeah.
Yeah. So assessing the risk can be difficult. We're very interested, I guess, in building up big data sets where we can start to look at predictively, if people are responding this way to a survey, for instance, what is the likelihood of someone becoming ill or having a workers' compensation claim or something like that. Yeah.
Yeah, and having that robust data source will really help in that risk assessment stage.
Yep. Then we have to control the risks. So this is where work design comes in, or work redesign. So once we've identified, someone is, working 10 hours a day when they really should only be spending 8 hours a day at work, or they're having to come in on weekends to get stuff done because the work requirements are just too much. Then we need to look at why that's happening. And a lot of companies I've seen, they'll jump to conclusions and they'll think, well, either this person is not suitable for the job, they're slacking off when we're not watching them, and there's probably a little bit of that concern happening with people working from home when employers can't see them directly. But what we need to do is consult with staff and go, well, we've felt from a number of employees, and again, this is something to specify as well, I guess, at this point, is that when we're looking at psychological health and safety or risk management, it's not about one person's experience. We're looking at when multiple people are having a shared experience, if you like, then that's a signal that the design of work is not great.
Yeah, that's correct. Yeah.
Yeah. Yeah. So when we, consult with workers, then we have a better idea. Okay, workload's high. You're having to work heaps of extra hours. Why is that the case? And then you find out things like, oh, well, if I look at my calendar, I spent 8 hours Monday and Tuesday in meetings. So I have a job that I've got to do as well on top of that. And I can't really get to my job because I'm having to attend all these meetings.
Especially during isolation, I would say there was a exponential increase in the number of meetings that was going on versus time to do productive work.
Yeah, absolutely right. It might even be things like, people are just getting bombarded with emails. And I'm very fortunate that, I've got a manageable inbox and I try and protect the employees that work for me from not getting excess emails. And one of the ways I do that is not getting customers to contact them directly. That helps a lot. But when you break it down, then often the control, which is that next step, becomes more relevant. Well, we don't have a workload issue; we've got a meeting issue.
Yeah.
Yeah. So maybe we need to think about who we're inviting to meetings, how long meetings are going for, having requirements that we have an agenda and stick to it within the meeting. Even have things like stand-up meetings so that people are motivated to actually get it done and get out rather than wasting time.
Yeah, that's a really good example. Yeah.
Yeah. So, and then the next thing we have to do is just monitor that over time, right? We put our controls, or we develop an action plan. Okay, we've identified what our hazards are. We know what the largest risks are. We've got some really great feedback from employees about what we can do to manage that risk. We've developed a plan with action steps and who's responsible and when are we going to measure or how are we going to monitor it and when are we going to review this again. And then we do that. We follow the action plan. We monitor it at the particular time points. And we see, have we actually improved? Have we actually reduced this risk? And at the end of a period of time, then you look at it and go, well, have we actually addressed it? If we have, what's the next biggest thing that we can attend to? So when we talk about developing a psychologically healthy and safe workplace, we're not talking about a company following a risk management process once and then becoming the most mentally healthy workplace on the planet. It's about just biting off in chunks, what's the biggest things that we need to focus on for the upcoming period. Let's monitor that, see how we're going, and then we'll review it and then, tackle the next things. And over a number of years, you could see an organisation becoming a much better place to work and reducing psychological injuries.
Yeah, and for companies that do have higher rates of mental health claims, we would expect that there would be some fairly easy gains to get just taking that structured approach to risk management. We'd be able to see some of those hazards that are really easy to address and hopefully intervene and have some success pretty quickly.
Yeah. Now, if we we're not going to talk about it now because we've already been talking for quite a while, and there's a couple other things I wanted to finish with. But we definitely need the risk management process doesn't just sit on its own. You need to have this enshrined in policy. You need leadership commitment. You need employees and health and safety representatives on board and having buy-in to the process as well. So we're going to talk about a number of those issues and hopefully get some good experts on to talk about them as well. Yeah.
Yeah, and ideally, you just want all of these elements integrated into your normal safety management system and the various policies and procedures and requirements that sit within that. So the more that you can integrate mental health risk management into your regular risk management processes, the more likely it's going to be that it just becomes part of everyday business rather than something that we have to remember to do.
Yeah, absolutely. And there's probably a whole discussion there around having a individual psych health and safety management plan or policy or workplace mental health policy versus just incorporating some of these things we're talking about into your existing health and safety policy.
Yeah.
Yeah. All right. So look, bearing in mind, we have been talking for a while and hopefully we still have some listeners tuning in. So we were talking about the integrated model of workplace mental health and I guess the three levels. So that's primary, secondary, tertiary prevention, or if we're using Tony's model, the integrated model, it's mitigate illness, prevent harm, and promote flourishing. What I wanted to talk about is maybe some statistics that are showing, I guess, the size of the issue worldwide. So I saw Peter Kelly from the UK Health and Safety Executive put some stuff up on LinkedIn recently, and Peter's going to be one of our guests actually in the first few episodes. Really interested in getting him on board. But he posted the latest stats from 2019, this was in the UK. They had 828,000 cases of workplace stress, which required time off, 17.8 million days lost. Yeah. Worst year on record, apparently.
Up until 2019.
Up until 2019.
We're not talking about 2020.
That's right. So that was pre-COVID. Now, he has estimated that it could hit 1 million cases for 2020 thanks to the extra pressures that COVID has put on everyone.
Yeah. Absolutely.
Yeah. So, this is the worst year on record. Again, as we were talking about before, even though we're getting much better in how we manage physical health and safety, it seems like we're just getting more and more workplace stress claims and psychological injury claims.
And certainly the feedback that I was seeing coming through from facility operators with the regulator was that their EAP providers were really being overwhelmed with the volume of calls that they were getting for people who were really struggling, to the point that they've sort of been really proactively recruiting and actually sending people so that they'll have a psych actually stationed at a facility, at an offshore facility, which is a fairly new thing going on, but actually having somebody going out there regularly, going out to the mine sites as well regularly. Yep. So people are definitely drawing on that EAP as a source of support, but I think what we want to do is get to people before they're at the point of needing the EAP.
Yep, that's right. So that was from the UK. Safe Work Australia stats have just dropped on the 12th of January, so just in the last couple of weeks, the latest. And I believe there was, this isn't all of the claims because it doesn't include people like the WA Police, it doesn't include anyone working for the Defence Force or anything like that.
Yeah, also people who are self-employed and probably companies who are self-insured wouldn't be included in that in those data sets either. So that's probably excluding quite a lot of really large companies. Yeah,
absolutely. Yeah. So it's keeping in mind that, okay, out of all of the injury claims that were made, 8% of them were related to mental disorders, okay, so stress-related conditions. That was 10,000 cases total. Now, we also have here the changes over time, and And what we can see is from 2001, it has gone up 28%. So we're seeing a big increase over that period of time. Now, the thing is, when these occur, they generally are more complex than many physical injuries and illnesses, and require longer times off work.
Yeah, absolutely. I think probably the other thing to note here is that these are only the claims that were assessed as compensable.
Yeah.
And that's, taking on balance outside of work factors as well as work factors, as well as ability to prove what was going on at work contributed to the development of the disease or illness. So my suspicion is that this is a significant underreporting of what's actually happening.
Yeah, no, I think you're dead right. So if we have a look, so it's gone up 28%, and then if we look at the average time off work, we're looking at a median of over 20 weeks.
And that's pretty significant.
Yep, absolutely. Now, New South Wales, Safe Work New South Wales have drafted a code of practice for psychological health, which they publish in September for comment.
Yes.
Yeah, and they publish some statistics along with that as well. Now, they're a little bit different to the Australian statistics, and I'd be interested if we can get Ian Firth on from Safe Work New South Wales in the coming weeks to talk to these statistics. But they have, when looking at the stats between 2019 back to 2015, they've tracked a 53% increase in psychological injury claims compared to 3.5% increase in physical injury claims. Yeah. So again, that gives credit to the health and safety profession in that we're actually managing safety risks, physical safety risks pretty well. But there's a huge opportunity for health and safety to get involved in the management of psychological risk.
Yeah, and it certainly suggests that strategies that are already in place are probably not very effective if we're seeing increases in the claims being made there.
Yeah, and as you alluded to earlier, there could be a number of reasons why people might just be more comfortable talking about mental health, but that's quite a large increase. And then the cost, the average cost per claim they've got is $85,000 compared to $21,000 for a physical health claim. So it's not just employers that are feeling this. Obviously, the insurers, will be feeling that cost, obviously themselves.
Yeah, it's a significant difference, and Safe Work New South Wales has said a $585 million gross incurred costs. So from a economic perspective, for Australia, it's a big challenge for us to try to address.
Yeah, absolutely, $500 million from one state.
Yeah. Yeah, absolutely.
Yeah, bearing in mind for those people who aren't aware of the geography, New South Wales is one of our largest states, if not the largest by population.
Yes, by population.
Yes. So WA of course is the largest by geographic spread. Yeah. But what we're seeing is year on year, the stats across countries like Australia, UK, Canada, even we're seeing a higher and higher prevalence of psychological injuries and work injury claims due to mental health conditions.
Yeah, and as we've said, there's probably a number of reasons for that. Just increasing awareness of these issues, probably GPs recognising when there's this sort of stuff going on and identifying that it should be a compensable issue. Yep. So I think that's definitely part of it. Possibly also just the changing demographics of the workforce, where we've maybe got fewer people working directly in line of fire type jobs. So we've just got a change in the risk profile overall. Yeah,
absolutely. Now, obviously, we have been, I guess, I know I definitely have been in this sphere, being a mental health professional, where we've been trying to promote to employers all the benefits of if you intervene in mental health or do these positive things for employee mental health. These are all the benefits you're going to get. You're going to get more engagement. You're going to get higher levels of productivity. This is your return on investment for every dollar that you put in. But it appears the carrot isn't working as well as we'd like.
It would appear so, yes. So absolutely we can start talking about your workers' compensation costs and your insurance premiums.
Yeah, that's right. And not to mention legal obligations, right?
Yes, absolutely. So as regulators get more interested in this, and certainly with the upcoming standard that's coming out, there will be, I think, increasing expectation that this is something that employers need to pay attention to. It is a legal obligation for them, and as we become more literate in talking about psychological hazards, it's certainly something that regulators are going to be paying a lot more attention to.
Yeah. And I guess at the end of 2018, we saw the Boland Review come out on the Model Workplace Health and Safety Act. And out of 34 recommendations, recommendation number 2 was to incorporate psychological health and safety much more into the Act.
Yeah. And that's been done to varying degrees in the different states.
Interestingly, WA is going to be joining the Commonwealth and following the Commonwealth WHS Act in the next year or so. Yep. And that's where we're expecting this to happen. And I guess what states are now doing and regulators is getting on the front foot. And that's why we see New South Wales put out their draft code of practice to help employers to take on the legislation changes when they come out.
Yeah, and certainly in WA, DEMERS have put out their code of practice for FIFO work. So for psychosocial risk in FIFO work, and that's obviously for a specific cohort. And there are unique psychological hazards for FIFO and for offshore work. But yeah, it's something that all regulators are thinking about and starting to act on.
Yeah. And I guess in most countries, this would actually come under legislation already, right? Under duty of care and for both employers and employees. And
absolutely. Yeah. Wherever you've got legislation that talks about general duties to protect the health and safety of your workforce, that inherently includes psychological health and safety. So even if it's not explicitly in your legislation, if you've got those general duties, then yes, you're responsible for reducing psychological risks to your workforce, the same as you're responsible for reducing physical risks. Yeah.
So things like the codes of practice, they're not legislation, but they're basically guidelines on how you can adopt, I guess, or meet the legislative requirements.
Yeah, and from a legal perspective, I think if you find yourself being prosecuted, the codes of practice in particular are held up as the minimum standard to which you should be performing. And you'll need to demonstrate that what you're doing is as good or better than those codes of practice if you find yourself in that prosecution situation.
Yeah. Now, interestingly, from the New South Wales code of practice information they put out, they surveyed the workplaces in the state, and they found that only 9% of workplaces were dealing with psychological health and safety from a systemic perspective.
I'd imagine that would be explicitly addressing it rather than other things that also happen to look after psychological health and safety.
Correct. So taking more of a systematic thing that might align with the code of practice, for instance, doing risk management, that sort of thing. But that means that, more than 90% of companies are not doing this.
Yeah, and that's not surprising for me.
But again, I see this as an opportunity for the health and safety profession, for psychologists. There's a lot of companies that need to do this and do it a lot better, and they're going to need a lot of hand-holding and guidance and support.
Yeah, and certainly, in the safety profession, there's always talk about, what's the next step change in safety? Well, here it is, it's mental health. Yeah. That's your next step change.
Yeah, absolutely. So I guess locally here in Australia, we're having a bit happen in the next year. There'll be more drafts, codes of practice coming out. We are expecting the legislation, the new legislation change to come out in the next year or so as well. But I guess in the next 3 to 6 months, on a global perspective, we're expecting ISO 45003 psychological health and safety in the workplace.
Yeah.
Yeah. So this will be the first internationally agreed standard on how do we manage the risk of psychological health and safety or psychological injury prevention. Very much draws upon the key standards from around the world, like the management standard from the UK, the national standard of Canada, the Safe Work Australia guidelines as well. So some of the key ones and the countries that have been leading the way in this space. But what's really exciting for me, Joelle, is that it fits under ISO 45001, which is the ISO standard for occupational health and safety management systems.
Yeah, and I'm certain that that's been done very deliberately.
Yes. But what this does, so ISO 45003 will become a child of the ISO 45001 standard. So basically it's dealing with how do you deal with this directly, this particular issue in relation to health and safety.
Yeah, and I think that what that also does is because it follows that same structure of the rest of the 45,000 series, where I was talking earlier about actually integrating those mental health risk management approaches into your safety management system, the way that the ISO standard is structured really will facilitate that.
Yeah, absolutely. But what this really does signal is that workplace mental health is no longer just a HR issue, okay? But the health and safety profession really does need to get involved.
Yeah. The other thing that I wanted to talk about was, this isn't just about individual health. And while that's certainly important, from a human factors perspective, when we talk about performance shaping factors, things that can impact the likelihood that somebody's going to perform their job reliably or potentially make a mistake that can contribute to an accident or a major event. Mental health really fits in as a significant performance shaping factor there. So, we know that if people are distressed, distracted by, worrying thoughts, anxious ruminations, however you want to describe it, we know that things like their ability to detect system anomalies, for example, or detect hazards is significantly reduced. Their ability to diagnose a problem when they're confronted with something and identify an appropriate solution, all of those things are impacted by psychological distress. So we're not just talking about individual health, we're also talking about impact on accident causation more broadly.
Yeah, absolutely. And it's not just the psychological injury claims as well, but we know that if you are experiencing high levels of stress or distress, then things like musculoskeletal issues can become a problem as well.
Yeah, cardiovascular, all sorts of things. Yep.
Yeah. So, so really interesting. And I'm not going to talk too much about ISO 45003 today because we're going to have some experts from the UK, Canada and Australia on in the first couple of weeks of the pod. So we'll hear much more from the horse's mouth in relation to that. But I guess one thing I wanted to finish on then is we've been talking about, I guess, defining what psychological health and safety is. Talking about some of the key stats. We've been talking about some of the standards and legislation that exists currently or is coming into place. Where are the opportunities for the listeners for this show?
Oh, well, employment opportunities. Yeah. This is going to be a growing area that businesses are going to be grappling with, and they're going to need people who are able to actually do this work. So, organisational psychologists or psychologists who have completed organisational psychology master's degrees. We want to be completely accurate about it.
Yeah, I should say Joelle's the only organisational psychologist here. I have a master's in occupational psychology, but it doesn't make me an organisational psychologist. We'll get into that with maybe Heather Ryken on another episode.
Yeah, probably. For people working in the org psych area, I think we are very uniquely positioned to really work with systems, organisational systems, where they interact with mental health. I think that we do have a really unique role in that space. But also just from your OHS professionals, this is something that you need to start paying attention to and looking for opportunities to upskill, looking for opportunities to engage with people who do have that the mental health competence. If you're not able to bring it in-house, then seek that guidance and seek that expert input.
Yeah, I see some health and safety professionals freaking out a little bit, and they're like, "Oh, now I've got to deal with mental health as well on top of everything else." But really, if you think about it, when you're talking about controlling risks, the health and safety person doesn't necessarily do that. It's like the role of engineers.
Yeah, absolutely. So the health and safety person should be facilitating that process and making sure that they've got the right expertise feeding into the risk assessment and into the development of appropriate control measures.
Yeah. So rather than engineers, in the case of psychological risk management, it's more, say, psychologists that would be the subject matter expert, if you like, or how do we diagnose and alleviate the issue.
Yeah, absolutely.
Yeah. The other one I've got in here, so we've talked about HSC, we talked about organisational psychologists. HR is another one where I think there could be real benefit from.
Yeah, so I think, if we had a Venn diagram, the mental health is really where we've got the crossover between the OSH and the HR professionals in the Venn diagram. So definitely those two roles within an organisation need to do a lot of collaboration in this area.
Yeah. And I think the other benefit I see for the HR profession is a lot of them want to do stuff in the workplace mental health space, okay? They want to, but it's hard to sell it to leadership because it's perceived as a nice to have rather than a need to have. But I guess when it becomes more of a health and safety issue, health and safety generally have a higher priority when things come up in the organisation, and they might have more budget as well to be able to do these things properly.
Yep.
So yeah, if it becomes a need to have and there's more budget available, then HR might find that they're able to do more initiatives in this space.
Yeah, absolutely.
Yeah. And then regulators. Now, coming from a regulator yourself, can you see any benefits for regulators for having, I guess, these new standards in place and health and psychological health and safety becoming more to the fore?
I think the benefit for regulators in having a standard to point to is that it sets out some, I guess, globally agreed on expectations for what a good risk management approach looks like in relation to mental health. So anytime there's a standard, a regulator is going to be able to do their job more effectively, I suppose. So that's the big takeaway for regulators with this standard coming out, I would say.
Yeah, absolutely. Definitely makes it more enforceable. At least companies don't have anywhere to hide anymore. The regulator can say, look, it's very clear, these are your obligations, and it's very clear that you're not fulfilling them. So, yeah. So, look, I think there's benefits for many professionals, and so hopefully those professionals that tune into the podcast will be able to up their skills and knowledge, and get a lot out of it.
That's the idea.
Yeah. All right. Well, what we might do, because we've been running for a very, very long time, I'm not sure how long the rest of the episodes will go for. I did say to Joelle, look, we've got some really great people on and we could probably talk all day with a lot of them, and some of them we might end up talking all day. Hopefully we keep it under a couple of hours as we have done today. But people hopefully will be able to tune in and out as the information is relevant to them. So just in winding up, thanks, Joelle. Thank you so much for joining us at People Diagnostics and helping us with the Flourish DX product. Going to be really great to be working with you and co-hosting this show with you. Don't forget, listeners, that you can tune in on YouTube as well. It's not just a podcast, but we video it, so you can see what Jason...
Just to add to the terror. Yeah.
The bright lights and the video cameras. So
very glamorous.
Yeah, so Jason and Joelle, if you want to see what we look like, then have a look on YouTube. And we will be sharing snippets from the podcast, interesting things from the guests that we have as well on LinkedIn. And you can follow either Joelle or myself. Feel free to connect with us. Yeah, or both. We're happy to. And also follow Flourish DX on LinkedIn for more information as we bring it to hand.
Good stuff.
Awesome. Well, thanks again. And we look forward to talking to our next guest next episode.
Very exciting times.
All right. Thank you all.